FMF made me proud to be a family physician, and I was inspired by my colleagues from coast to coast who provide such a spectrum of care to Canadians. I couldn't have said that better myself.
FMF is where I meet my family of family physicians across the country.
This guy loved the wellness lounge. Me too, man. Me too.
Très instructif et aidant pour notre pratique médicale.
You can tailor your experience at this conference to your interests and what you want to get out of it. Therefore, it is always applicable no matter how focused or how general your practice is.
Mémorable.
If you want to be influential in family medicine, especially on a bigger stage, this forum is almost a must.
It exposed me to a new area, to me, that I otherwise did not know about. In this case, medically unexplained symptoms.
Format tout inclus pour la formation médicale continue.
This one says, bang for your buck in every way. Totally agreed.
Massage therapy chairs. Thank you for this. You're most welcome.
Exceptional material that is well crafted and driven independent of pharma.
It's a get-together with my professional family. Je compte bien y retourner. Au plaisir de vous voir en octobre.
I was pleasantly surprised by the quality and breadth of topics. There were more networking and discussion groups than other conferences I have been to.
FMF was a great experience as a first-year resident, both for my own learning and for networking with fellow family medicine residents and physicians in practice.
Best conference, hands down. Thanks, we think so too.
FMF is a great time and place to connect with what is uniquely and intrinsically important to family docs in Canada. Essentially, it is about us, for us, and developed by us.
That's pretty cool. Family Medicine Forum is taking off. Here's what you can expect from Canada's top conference for family doctors. 4 days of education. Hundreds of networking opportunities. Thousands of attendees. Countless connections made. More than 400 educational sessions. Over 200 exhibitors. More than 20 epic social events. Hundreds of award winners. Thousands of amazing ideas. All taking place in one incredible city. FMF takes off this October 30th to November 2nd. Follow us for all FMF updates. Don't get left behind.
Here's a good one. I like that most of the presentations were given by...
Good morning. I'd like to welcome you to the CFPC's federal election debate. This is the first time the CFPC has held a live stream session focused on the federal election, and I'd like to offer a warm welcome to our guests. Joining us through Skype, we have Ms. Marilyn Gladu, the Conservative Party of Canada candidate for Sarnia-Lambton in Ontario, and most recently the Conservative health critic. Madame Ginette Petitpas Taylor is a Liberal candidate for Moncton Riverview Dieppe in New Brunswick and previously the Minister of Health. In studio, I am joined by Dr. Hal Berman, the NDP candidate for Markham Stouffville in Ontario and a palliative care physician. And Dr. Jennifer Purdy is the Green Party candidate for Canada Carleton in Ontario and is a family physician in Canada. Welcome all. A few notes before we begin. Each candidate has been invited to provide statements covering the CFPC's 3 key priority topics: access to family practices via the patient's medical home, integration of mental health into primary care, and universal national pharmacare. Hewing to the rule of 3, each statement will be 3 minutes in length. After all participants finish their statements, candidates may provide responses. The final 20 minutes of the debate will be open to your questions, centering on the 3 issues discussed during this debate. Viewers will submit questions into the chat box. We'll begin with statements starting in alphabetical order. I invite Dr. Berman.
Thank you. I'm very grateful to have the opportunity to speak today regarding healthcare issues in this election. During elections, there are a lot of things that compete for attention. In this election, climate change rightly has one of the top spots. And recent leader scandals and a bit of mudslinging have consumed a lot of political oxygen. But healthcare is really important and it needs to be discussed. An Ipsos Reid survey that was conducted by the Canadian Medical Association back in the spring showed that Canadians, of the top 10 worries that they have, 3 of them are about healthcare. They're worried about their personal health, both physical and mental, and also they're worried about access to care. Moreover, their top worry for Canada is the healthcare system. They discovered that fully 60% of respondents will base their voting intention on which party addresses these concerns. As a physician with an interest in healthcare policy, I'm extremely proud of the New Democratic's head-to-toe policy. I believe that it's the most comprehensive and considered of all the parties, and it includes an achievable timeframe for implementation. I'd like to touch on a few highlights of this program. Access to primary care is key for health maintenance and illness prevention. In my experience, both as a hospitalist and in home care, the multidisciplinary collaborative approach is the best model. And that's why my party and I support the concept of the patient's medical home. And we would implement this in 2 ways. We would immediately do this in areas where the federal government has jurisdiction, including First Nations, federal inmates, Canadian forces, and refugees. We would also act as leaders to establish a national standard for this care model, and we would work with provinces to implement this. When I talk about an integrated model for a healthcare plan, this by definition has to include mental health. Access must be improved by integrating mental health right in with primary care and ensuring timely access to specialists when needed. The Collaborative Mental Health Care Network provides specialist support, and the network I currently work with includes a psychiatrist who's even able to do home visits when necessary. So we know that this can be done, we just need to get to work and set up a national standard. Another important aspect of healthcare is pharmacare. The NDP has advocated for this for decades, and the Liberal Party have promised it for decades, but even in this election, they've backed away from committing to it. An NDP government will begin the implementation in 2020. This will result in lower costs overall, primarily to individuals and businesses that offer private benefits. And when you add dental care to the mix, the NDP has, in my professional opinion, the best healthcare plan for Canada. Thank you.
Thank you very much. We'll go to Ms. Gladu.
Thank you. Canada is facing a healthcare crisis. We have a shortage of doctors and physicians and medical workers of all kinds across the country. We have an aging demographic. 1 in 6 seniors today, that will be 1 in 4 in just 5 to 10 years. And at the same time, we have a shift to chronic disease, with 11 million Canadians having diabetes or pre-diabetes, and 1 in 2 Canadians will have cancer in their lifetime. And so in the middle of this crisis, the last 4 years under the Liberal government, their priorities have been to update the Canada Food Guide so that you could learn that you need to drink more water and enjoy your food. They spent $80 million to get people to stop smoking, and then $800 million to get people to start smoking marijuana. And at the same time, they did not address adequately the opioid crisis that has been taking the lives of Canadians, nearly 10,000 Canadians over the last 4 years. And their solution has been safe injection sites, but they've neglected prevention and recovery. And so they've also penalized medical operations and corporations by increasing the business taxes on them. Conservatives will come with a plan. We will come with a plan to address the aging demographic, and we will work with provinces and territories to make sure that doctor and nursing and medical worker shortages are addressed. In fact, Andrew Scheer has already written to the premiers of the provinces and territories to guarantee that we will increase health and social transfers under a Conservative government, because we recognize we need more money in the healthcare system, not less. In terms of mental health, we will come with a fulsome strategy on addictions, from preventing people from getting on drugs in the first place to recovery beds to actually help people get off drugs. We want to support suicide prevention, and we believe that there's more to be done in the area of dementia. We have this increased aging population, and the current Liberal pledge of $4 million a year for the 400,000 people that already have dementia, that's $10 a piece. So we think that's inadequate. We would do more. The Conservative record on mental health is clear. We will honor the commitment of the $5 billion over 10 years for mental health and continue to work with the provinces and territories to make that happen. In terms of pharmacare, I was on the health committee studying pharmacare, and we do not support the $20 to $40 billion national pharmacare solution because 98% of Canadians actually have a plan. We will come with a solution that will address those that don't have access to their medications. We will work with the provinces and territories to come with a standard list, because today we have people moving from one place to another in order to get their coverage. We will also come with a framework for rare disease drugs, which today are not funded by many provinces, and so we will come with an answer there. In terms of the model on patients' medical home, we absolutely support coming to these better ways of delivering service at a lower cost. Andrew Scheer and a Conservative government will put more money into the pockets of Canadians by cutting the carbon tax, by eliminating the small business taxes that were imposed on corporations like medical ones, and by cutting the GST on home heating and a number of measures to make sure that people can afford to get ahead. And so thank you.
Thank you very much. Over to you, Madame Petitpas Taylor.
Well, good morning. Before I begin, I would also like to acknowledge that the land in which I gather is the traditional unceded territory of the Mi'kmaq and Maliseet people. I want to take an opportunity to thank the College of Family Physicians of Canada for inviting us to have this very important discussion, a discussion that really impacts the lives of all Canadians. The three priorities of the family physicians and the college have identified, those being patient medical home, pharmacare, and mental health, are really important, and I have to say, really spot on. As a government and as a party, we have worked hard to promote an approach to healthcare that is comprehensive, compassionate, collaborative, and evidence-based. And this is reflected in our record and also in our platform moving forward. While the term patient medical home may not be familiar for many Canadians, I think that the approach is something that we all can relate to, and it is certainly an approach that we are committed to supporting. As you know, before I entered politics, I was a social worker or worked in the social work field for 25 years. And I personally saw firsthand the importance of interprofessional teams and the collaboration in providing the best possible care for Canadians. And I also know that integration needs to go beyond primary care teams. I sat at the cabinet table where nearly every decision considered the social determinants of health. We know that things like housing, education, and employment have a huge impact on health outcomes. And we have taken action over the past 4 years to support a holistic approach to improving the health and well-being of all Canadians. Part of that vision is also about creating better parity between physical health and mental health. And I have to say, I'm extremely, extremely proud to be a part of a government that has taken bold action, unprecedented action, to bring mental health at the forefront. And this starts with the largest ever investment in mental health in Canadian history, a groundbreaking $6 billion towards mental health and addiction services. This funding is going where it's needed the most, including support for youth, early intervention, and culturally appropriate services for Indigenous people. It would help transform how we approach mental health. And we have committed to doing even more by setting clear national standards for mental health services so that Canadians can get the support that they need in a timely manner. And finally, a few comments about access to prescription medication. Our government has made it very clear that we believe that no Canadian should have to choose between putting food on their table and paying for prescription medication. We are firmly committed to making sure that all Canadians have access to a universal national pharmacare program, and that work is well underway. Over the past 2 years, we've been working diligently at making sure that we reduce the prices of drugs, and also we are working very carefully, side by side with the report that was prepared by Dr. Eric Hoskins and the Advisory Council, looking at the key principles, the analysis, and moving forward with the recommendations for a path forward. So together, I know that we can certainly meet these priorities. Thank you.
Great, thank you very much. And we will close the statements with you, Dr. Purdy.
Thank you. Good morning, and thank you for taking the time to listen in. Canada is such an affluent nation that Canadians should have better access to primary care. The Green Party supports the concept of timely access and patient-centered care in the patient's medical home. The Green Party recognizes that healthcare delivery is provincially delivered, but the federal government can influence healthcare delivery primarily by the Canada Health Act and by transfer payments. The Greens will restore the federal-provincial health accord, basing the health transfer on demographics and real healthcare needs in each province and territory, as opposed to the current formula based on GDP growth. While the Greens support the concept of the patient's medical home, we recognize as well that moving towards this model nationwide will clearly require the cooperation of the provinces and territories. It will also require working with First Nations and Inuit people to ensure a culturally appropriate and relevant care model. Finally, it will require a significant influx of resources. Regarding mental health, the Green Party wants to close the significant gaps that exist. Mental health services should be a component of primary care, and clearly there must be better accessibility to both counseling and psychotherapy services. The Greens will negotiate a new Canada Health Accord to prioritize expansion of mental health services and reorient Health Canada's mandate towards mental health and addiction, health promotion, and disease prevention. The Green Party supports the adoption of a Mental Health Parity Act. We strive to be evidence-based, and as such, we will decriminalize drugs and will ensure, where necessary, patients have access to a safe supply of medication or drugs, in the case of medical heroin, but also the medical support needed to treat addiction. Pharmacare. It was first recommended in the 1940s, and somehow 80 years later, neither the Conservatives or the Liberals, including the current government, have been able to do anything about pharmacare. The Green Plan is to introduce a fully funded pharmacare, and we are not depending on the provinces for cost sharing, and therefore, this plan is set up to succeed, not fail. Our plan has been costed out, and it is for this reason that it is more costly, $26 billion projected in 2020. We will make pharmacare more affordable by creating a bulk drug purchasing agency and reduce patent protection periods. The Greens support the concept of interprofessional healthcare teams. We want mental health services integrated in primary care. We plan to implement pharmacare. We wish to reset the federal relationship with physicians because we are cognizant of the increasing demands placed on them. We will work with provinces and territories, First Nations and Inuit, and provide the appropriate funding to help our society become more equitable and healthier. Thank you.
Thank you very much, Dr. Purdy, and for everyone for their comments. This part of our discussion is now open to all candidates. You can pose questions to each other and comment on what you've heard. So the floor is open.
Can I start with a question for Ms. Petitpas Taylor? I listened with interest to what you were saying, and you mentioned that your party is committing $6 billion towards mental health care. But in your platform, you're committing $6 billion for all healthcare initiatives. So how are you going to put all that $6 billion towards mental health care and also fund all the other promises that you're making?
Well, first and foremost, I think we have to be very clear in the platform announcement that we made. We've indicated that one of our priorities is to make sure that all Canadians will have access to a family physician. We know we have several physicians here on the panel, and we're all very aware that there's many individuals in my riding and also across the country that don't have access to a family physician. That is certainly a priority of ours. The Prime Minister has made it very clear the $6 billion that was put on the table is a down payment. We certainly recognize that we have to continue to work with provinces and territories. And once again, being a frontline social worker for many years, I've worked with many people facing mental health challenges and issues with respect to addictions. So it's an absolute priority. And that's why that we want to move forward with respect to strengthening the Canada Health Act to ensure that mental health services can be a part of that. Canada is such a huge country, and we certainly recognize that from coast to coast to coast, there's differing services that are available, and we want to make sure that Canadians have access to those services in a timely fashion. Once again, it's a down payment, and then from there we'll continue to work with provinces and territories to make sure that we can meet the needs of Canadians.
I have a question for Ginette Petitpas Taylor. The Quebec has been clear that they will not be part of a national pharmacare program, and after studying for 2 years on Health Committee and then another year under Eric Hoskins, the cost of such a program is estimated to be between $15 and $40 billion. So how will your government pay for this without increasing taxes on everyone?
Well, I thank you very much, Ms. Gladu, for the question. And I think we have to recognize that the cost of not moving forward with a national pharmacare program continues to be astronomical. Many individuals don't have access to prescription medication, and their medical conditions continue to deteriorate. So I think we have to move forward with respect to looking at as to how we can move forward with respect to a national pharmacare program. Specifically to your question with respect to the province of Quebec and any other provinces, we've made it very clear with respect to a national pharmacare program that constitutionally we can't impose this program on provinces and territories. They will opt in as opposed to opting out. And we will continue to work with provinces and territories. I am convinced that when constituents are going to be speaking with their provincial and territorial counterparts, they're going to be telling their provincial officials that they really want to move forward. We certainly recognize that if we get together with 13 provinces and territories, our negotiation power is going to increase even more. And then from there, provinces and territories will in fact save more money. So I'm very optimistic. I have to say, when I hear the new Democratic Party, and perhaps it's a bit different today with what I'm hearing, saying that the implementation process will start in 2020, I think we've been clear as well that we've been moving forward with respect to putting in place this service. But the actual leader of the NDP, I've heard very clearly, has indicated that pharmacare would be in place by the end of 2020. He wasn't talking about starting the implementation, but rather saying that it would be in place by 2020.
That's even better, wouldn't you say? So it will be implemented in 2020, and implementation means getting it in place and having it working. I think it's really important to think about, to look at it. In 1997, your Liberal government, the past Liberal government, promised pharmacare. Now you're promising you're going to work with the provinces to implement it. That's the same promise that was made in 2015. So I don't see any movement from the Liberal Party on this. I don't agree with the Conservative approach to ignoring pharmacare completely and leaving it up to the provinces. I think that the federal government has to show some leadership, and I think that we have the spending power as a federal government to provide that leadership. And just like Tommy Douglas brought in Medicare in Saskatchewan, the federal government picked it up, and all the provinces went along with it. I believe this is what will happen with pharmacare as well.
Actually, I think excuse me, I'm going to speak actually. I think the approach to pharmacare is very similar between the Conservatives and the Liberals, except the Conservatives are being honest that they're not going to introduce it, even though I believe pharmacare would be much better for the nation. The Liberals, Mr. Trudeau is already signaling that he's going to have problems. So with certain provinces, yes. So it's going to be set up. The negotiations will be such that preferably for the Liberals, the Conservative premiers of the provinces will say no, and then it will be on the Conservative premiers, and that will be the reason why the plan fails. I do not think why would the Liberals be serious? They haven't been serious for 60, 80 years about pharmacare. So why now?
Respect the work that's been done over the past 2 years. On my watch, we have made the hugest regulatory changes when it comes to the Patented Medicine Prices Review Board. We've heard from many parties over the past year saying that we weren't going to be moving forward with this. The regulations that we've brought forward are in actual fact saving us $13 billion over the next 10 years. That is the foundational work that needs to be done. Also putting together a Canadian Drug Agency in order for them to do the work with respect to putting together the formulary, and also for them to be doing the negotiations with respect to lowering the cost of drugs. That's work that's well underway. So with respect to the Liberal government being serious about this, we've been doing a lot of the work over the past few years, and moving forward, we certainly want to make sure that we get this right. And again, we need to have a plan, and that's why that we've asked Dr. Hoskins of the Advisory Council to provide us with additional feedback with respect to this. I'm excited with the work that has been done, and we will continue to move forward in making sure that all Canadians have access to the medication that they need through a universal pharmacare program.
I think
so
it's
Dr.
important
Hoskins
to say
actually,
that the,
sorry, go ahead.
Patented Medicine Review Board changes that the Liberals are bringing in, the stakeholders are all saying that this will have a negative impact on Canada. It will make our drug approval process longer and more costly, and it will put clinical trials at risk and actually result in Canadians having less access to new medications. And the Liberals have not listened to any of that information. We've already had a huge number of drug shortages, and that's why they run a web page listing them.
So
I don't think there's any evidence, though, actually. Sorry.
Go ahead, Dr. Purdy. Yep.
I don't think there's any evidence, because sometimes the argument is used that, oh, if you were to have a pharmacare and if we have better drug price controls, that the money will go into R&D. And that is not proven. It just goes, it becomes dead money with the pharmaceutical companies. And so this is an opportunity. And repeat, we didn't need a Dr. Hoskins study, I don't think, because we already had at least 4 major commissions and studies since basically the 60s on pharmacare. So I honestly think that was another example of signaling. But anyways, there's clearly economically this would be better both for individuals and as well as for the country as well. But there's two big industries that will lose out, of course, and it's insurance and the pharmaceutical companies. And that's why I think we're still talking about this in 2019.
Yeah, Ms. Gladu, I'd like to pick up on something that you said about putting more money into the pockets of Canadians. And you talked about the carbon tax. And one of the things that your party has actually failed to do is to mention that for all of its flaws, the Liberal government's carbon tax actually puts money back into the pockets of Canadians as well. And most Canadians do not pay very much in the carbon tax after they get their rebate. So there's not actually a lot more money going back unless you're planning to give the rebate and stop the carbon tax, which would be completely ridiculous. Whereas I'm not finished yet. Whereas a pharmacare plan would actually put money back into Canadians' pockets because they wouldn't have to pay for those medications out of pocket. This would be much better. This should actually be something that your Conservative Party is promoting, and I'm not sure why you're not.
So first of all, what you said about the carbon tax is absolutely not true. I received my climate action rebate for $169 this year, but I would tell you that I'm paying $10 a week more in gasoline, not to mention increased prices in groceries, etc. The estimate is that the average family or the average person is going to spend about $1,500 on the carbon tax. And under the Liberals, they're projecting to increase that by a factor of 5. So there's a huge amount of money there. And putting that money back in the pockets of Canadians allows Canadians to go buy pharmacare, dental care, medical plans. Those things cost about $1,200 a year. I used to buy one myself. And so putting thousands of dollars back in the pockets of Canadians will result in them being able to afford their medications.
I think you're underestimating the cost of a private drug plan. And I think that you and your party are underestimating or overestimating the number of people who are actually covered by a private drug plan. I see patients at home all the time. I do palliative care. I take care of the most vulnerable patients, and many of them don't have access to drug plans. So I think you need to go back and check your numbers, because what you're telling Canadians is wrong.
Coming from the Canadian Conference Board that says there's 660,000 Canadians that either don't have a plan or aren't eligible for a plan. And having a plan is not the whole story. Keep in mind that, having a plan and the public plans only cover 4,500 drugs compared to the 14,000 under private plans, and each province has a different list. That's also a source of people not having access to their medications. Not to mention
all the more reason to have a national single-payer universal pharmacare plan. I thank you for making the argument for me.
Excellent. Yeah.
No, not at all. For $20 to $40 billion of increased taxes, it's actually cheaper. The C.D. Howe Institute says you could put everybody that doesn't have a plan today on the existing public plans for $2 billion. That's a better solution right there.
Does anyone want to answer that, comment on that particular?
Yeah, well, I think probably many family physicians across the country right now have an answer in their head, because we all are used to asking people, do you have coverage or not? And oftentimes the answer is no. And C.D. Howe is not necessarily a reputable institute in terms of being lacking bias either. So I don't know if I would be citing them as well if I were you. But no, pharmacare, clearly there's been 4 major studies. No, it's not the C.D. Howe Institute, but it suggests they were perhaps a little bit more respectable, more credible. And over time, the answer has been repeatedly clear. And I'm actually ignoring Dr. Hoskins' report because I don't think it was necessary. I feel it was just signaling that they're going to do pharmacare and then they're going to drop it and have it fail. But anyways, economically for both individuals and for the nation, we will do better if we cut out if we cut pharmaceutical industries in terms of having better price controls and bulk purchasing, and then also cutting out insurance. But they're two big, powerful industries. And actually back in 98, 99, the Minister of Health at the time actually acknowledged that it was lobbying from the pharmaceutical industry over jobs being lost. So jobs is always a very popular but not necessarily accurate excuse. But that was why they were not proceeding on pharmacare at that time.
I know it's hundreds of times have ministers and members of the government met with lobbyists from the pharmaceutical companies.
Good question.
Madame Petitpas Taylor?
Sorry, I didn't hear the question. Can you repeat it?
So how many hundreds of times have members of the Liberal government met with lobbyists from the pharmaceutical industry in the last 4 years?
Our government has met with many individuals with respect to different groups, but I can tell you with respect to the modernization of the Patented Medicine Prices Review Board that we've done just in August, I think that people were actually surprised, but also knew that we're taking this work extremely seriously. We have done our due diligence with respect to the work that needs to be done, and the modernization that we've brought forward, as I've indicated, is going to save Canadians $13 billion a year. When the pharmaceutical companies are bringing me to court for judicial review because they're not pleased with the work that we've done, because it's going to be affecting their bottom line, I think that we have to recognize that we are doing what needs to be done. And putting down the prices of prescription medication is the foundational piece to make sure that we can afford a national pharmacare program. And I, for one, am extremely proud of the work that we've done and that we're going to continue to do to make sure that this program is sustainable for all Canadians.
I don't think that anyone would deny that there hasn't been some work done. And actually, I have to tell you, with all respect, I think that your heart is in the right place. But but the Minister of Health that you succeeded has herself gone on record to say that the Liberal approach is inadequate. And I think what we need is, rather than little incremental growth where the pharmaceutical corporations get a lot and Canadians get a little, we need a drastic change. We need to complete the journey that we were started on by Tommy Douglas and get universal health care done right away.
If I may, I don't think that I have heard at any time since the changes that have been brought forward by the Patented Medicine Prices Review Board saying that they've been inadequate. Actually, all officials, all health care providers and researchers that I've heard from have actually applauded the regulatory changes that we've made. So perhaps that you've heard something that I haven't heard of, but the feedback that I've received has been overwhelmingly extremely positive.
I was referring to in general, the approach towards moving towards pharmacare, not just that particular step that you've taken.
Well, I think that we have to keep in mind, once again, that the work that we've done over the past 2 years is not just a plan on a napkin. We've been working hard at meeting with different groups and making the proper changes. And when I hear you say that you're indicating that we're not serious about moving forward with the National Pharmacare Program, if we weren't, why would we be doing all the work that we've been doing? Once again, it's foundational work that needs to be done, and to move forward, we want to make sure that we're doing it responsibly because we want to meet the needs of all Canadians. I'm not a doctor.
Wait until 2019 to start.
When I used to be a social worker would bring clients to the hospital to receive services, and the doctor would give them a prescription, the client would look at me and say, Ginette, what am I supposed to be doing with that? We are committed to making sure that Canadians have access to prescription medication, and we want to make sure that it's a universal model that everyone has access to the medication that they need.
My children are actually old enough now to remember a time when we didn't have universal pharmacare. My fear is that if we continue with the Liberal plan, or at worst, go with a Conservative plan, that my grandchildren will remember a time when we didn't have universal pharmacare.
Ms. Gladu?
I just wanted to clarify, the Conservatives are not saying we're not going to do anything. We have an approach to get access for people that currently don't have access. We just don't want to replace people that already have private coverage and public plans because it's not necessary. So I just wanted to add that. Now I have a question for Ms. Petitpas Taylor about the addiction crisis in the country. What is the Liberal Party planning to do to add recovery beds across the country to help people get off drugs?
Well, first and foremost, Ms. Gladu, I'm extremely proud to be a part of a government that has added harm reduction as a key pillar of our Canadian drug strategy. I've heard very clear from your leader, Mr. Andrew Scheer, indicating that when it comes to supervised consumption sites, He's not very pleased with that, and he's not very supportive. When it comes to medication replacement therapy as well, he's made it very clear that he is not supportive of those types of measures either. At the end of the day, I know that supervised consumption sites save lives. If we look at British Columbia alone, we look at the statistics that in the supervised consumption sites, they have overturned over 3,000 overdoses. So if those services wouldn't be in place, we would be adding 3,000 deaths to that number. So moving forward, we will continue to work with provinces and territories. We will continue to support harm reduction measures. And also, we have to first of all, meet clients where they're at, not where we want them to be. We have to recognize that substance use disorders is a disorder. It's a medical issue, and it has to be treated as one.
But there are wait times right now of 6 months to 18 months to get into recovery. There's not enough recovery beds for the people that do want to get off drugs. That's the part that you're missing.
Well, we're not missing that part at all, Ms. Gladu, because we've made some investments with respect to providing emergency treatment funding and also additional funding to provinces and territories. But once again, we have to meet clients where they're at. It's not what Ginette wants them to do, and it's not what Marilyn wants them to do. This is a public health issue, and we have to treat it as such.
But the other thing, too, is Ms. Petitpas Taylor, is your government, your party prides itself on being evidence-based when the evidence works for what the party wants to do. And yet, even though the evidence clearly points towards decriminalization, if you look at certain nations around the world who've decriminalized drugs and adopted harm reduction strategies, your government is refusing to decriminalize opioids, and that's obviously a big piece of the puzzle, and it's contributing to deaths right now.
I think it's very important that we remember that addiction is not a crime. Addiction is an illness. It's a mental illness. And I think that a mental health strategy, an addiction strategy is really important. If you take a look, and I'm very, very happy with the movement towards harm reduction, and I don't have any criticism of safe injection sites that have been promoted and supported by the Liberal government. That's fine. I don't think any reasonable politician would be against that. My big concern is if we elect a Conservative government, all we have to do is look at Ontario and see what happens if we elect a Conservative government where safe injection sites are under attack. There is absolutely no support for addictions. It's all about recriminalizing, re-stigmatizing people with addictions, and that's absolutely not the way to go.
Well, an Andrew Scheer government, for sure, is not going to, come against what's already in place. We're going to add to it prevention and recovery, because we see that, people that are safely injecting today and safely injecting tomorrow eventually don't safely inject and they die. So we don't want to keep people, safely addicted to drugs. We want to see people get into recovery and get on with their lives.
But actually, Ms. Gladu, for people who can safely inject with medical-grade heroin, then in a safe location with clean needles and sterilized equipment, then they will often stay safe. And there's countries like Switzerland where people can come, they can get their medical-grade heroin, inject, and then they go and they are productive members of society. So, countries that have decriminalized see drops in their crime rates. They actually see drops over time in drug use rates, so it doesn't cause everything to blow up and for drug use rates to increase. There's actually a good body of evidence and time as well, because Portugal, for example, decriminalized, 20 years ago or so. So there's a nice body of evidence supporting decriminalization. That is where the evidence is at.
But wait, Portugal had a lot of things in place before they decriminalized, right? They had 170 recovery facilities for 11 million people. They had truly universal health care, including mental health supports that were adequate for the population. And they had mandatory education in the schools and in the public about the harms of drugs. And it's not that that people didn't receive any punishment or any help when they were caught with drugs. They go before a tribunal that has representation, right, from legal, medical, psychological, and so they can sanction them to give them the mental health therapy that they need, maybe to address the root cause of their trauma, or to send them to recovery, or if they were a healthcare worker and they were a multiple offender with drugs, they could sanction them that they couldn't work. We don't have those things in place in Canada, and so decriminalizing without all those things in place is not going to achieve the same result.
Actually, Ms. Gladu, I'll point out a slight correction. The tribunal came came into existence after they decriminalized, and it was not to sanction a person. If a Portuguese citizen presented in front of the was caught using, presented in front of the tribunal, they would be given the option, would you like to quit? And if so, they were within treatment within days, because all the resources that were going towards policing were reallocated towards healthcare and recovery beds, as you suggest. But then if they were not interested in quitting, then have a good day. That was it.
I'm going to actually give the last word to you there, Dr. Purdy, because we're going to go to questions from our members. So at the beginning of this discussion, of this debate, CFPC members were welcome to ask questions. Note that you can ask questions pertaining to the discussion held thus far, and you may ask questions in English or French. For the candidates, I will read questions in French. I'll give you the gist of it in English, and it is up to you to respond in the language of your choice. So we do have one question, and it is, anyone can answer it. It's not directed at anyone in particular. So it is in French. I will read it in French and then again give the gist of it in English. So, l'accès aux soins est un problème dans la communauté rurale. Votre parti a-t-il des plans pour rendre des médecins de famille et l'équipe interprofessionnelle plus accessibles pour les personnes qui vivent dans les régions rurales et éloignées? So rural communities can struggle with timely access to care. Does your party have plans to make family medicine and interprofessional teams more accessible to people living in rural and remote areas? We can start, why don't we start to my, okay, Dr. Purdy.
Okay, yeah,
yes.
Non, je peux commencer. Pour moi, ce problème est une solution qui peut aider beaucoup de monde, parce que présentement, il y a un problème où il y a des personnes qui ont reçu leur diplôme en médecine dans les pays out of country, right? They are foreign medical school graduates. Et il y a des problèmes à trouver une place pour faire les résidences. They can't find residency spots. Donc, une solution, ce serait de sorry, I'll say the rest in English, but just to give more, to provide more in transfer payments to the provinces so that they provide more residency spots, because there's also even Canadian graduates from medical schools who are sometimes not matching for residency spots. This could be changed with some funding so that we could be taking IMGs who are looking for residency spots, Canadian medical students who have not matched, and provide them the residency spots by funding the provinces to provide more funding for the residency spots, but then therefore I'll have a return on contributions sort of scenario where the residencies would the residents, once their residency is completed, would need to work rurally. The other solution, and this links in with one of the CMA's priorities for this election, is to utilize telemedicine, because some of the colleges across the country are still a bit slow to allow telemedicine, and it's not the appropriate solution for everything, but for many different types of medicine and for many different medical encounters and nursing encounters, it can be an elegant solution that is incredibly low cost, so that the people in rural communities do not even have to drive for any sort of distance.
Thank you, Dr. Purdy.
The Conservative Party will come with a plan that will address the shortage of doctors and nurses and resources and infrastructure across the country. You see that we have pledged $1.5 billion for new MRI and CT scanners to try to get at wait times. We also will work on credential recognition. So if there are not enough healthcare workers in Canada, that we would be able to bring them in through our immigration process and recognize their credentials so that they could participate in staffing in those rural communities.
Thank you, Ms. Gladu. Dr. Berman.
So I think credentialing is definitely one thing. I would point out that in the 10 years that the government was a Conservative government, there was very little progress made in credentialing foreign grads. I met many foreign grads, and the ones that actually made it to do residencies with me, for each one of them, there were many other people who still were having trouble finding a place to do their training. I think that I'm not going to say the same things that Dr. Purdy said, because we do agree on a lot of things. I want to point out that people who grow up in a community are more likely to want to work in that community. The problem is that if you live in a community where it's hard to earn enough money to pay the $20,000, $25,000 in tuition every year, when you run up student debt to astronomical amounts, not as much as the United States, but still very high, it's very difficult to commit to an educational degree. So the NDP is going to stop the gouging of medical students and all students. They have a plan to stop collecting interest on student loans. The federal government in the last 4 years has collected $3 billion in student loan interest from students. Making it easier for people to go to school will make it easier for them to get a medical degree and come back and work. Plus, the NDP has long advocated for incentives for people to work in underserviced areas. And these would be long-term incentives. For instance, if you do have student debt, paying off that student debt for you over 10 years wouldn't be that expensive for the federal government, but it would be actually quite helpful for the individual. Once people have lived somewhere for about 10 years, they're more likely to stay there. And another way of keeping them there would be to have supports, like making sure there are locums available for vacations. For people who work in small towns with 1 or 2 doctors, they feel they can never take vacations. Having access to surgical support, having access to telemedicine for consultations and things like that. And we're very interested in working with the provinces to finally get Canada-wide licensure in place.
Premièrement, si vous me permettez, c'est une très bonne question, puis une question que je sais qui nous est posée souvent. Je pense que premièrement, de s'assurer que tous les Canadiens vont avoir accès à un médecin de famille doit être une priorité pour tout le monde. Dans un pays aussi riche que le Canada, on doit faire le meilleur possible pour s'assurer que les gens vont avoir accès à un service. Je pense aussi qu'on doit reconnaître que le Canada est tellement un grand pays aussi quand même. On ne peut pas oublier la question d'innovation aussi. Puis quand on entend parler des soins télémédecine, mais aussi les soins virtuels, je pense qu'il y a beaucoup d'investissements et beaucoup de travail qu'on peut faire à ce sujet-là. Et puis un autre commentaire que j'aimerais faire, moi j'habite dans une petite province du Nouveau-Brunswick et puis souvent nous entendons parler de la question du manque de médecins de famille. Je suis très contente d'un petit bijou que nous avons dans notre communauté, de l'école de médecine à travers de l'université de Sherbrooke, mais l'université de Sherbrooke a une école ici à Moncton. Et puis chaque année, nous graduons à peu près 25 médecins. Et puis ces médecins-là quand même restent dans la province, puisqu'ils font leurs études ici et puis ils vont s'enraciner ici dans la communauté. Et puis je pense que d'autres programmes de ce genre-là dans les petites régions pourraient aussi encourager les médecins à rester dans leur coin. Mais des investissements sont essentiels à faire dans le domaine de télémaladie, de télésoins, et puis aussi dans le domaine de soins virtuels, puisque je pense qu'on pourrait vraiment sauver des argents, mais aussi développer des services qui pourraient rencontrer les besoins des gens dans les régions rurales.
Merci beaucoup à tous. So a question in English, and again, you are welcome to answer in French if you wish. This is, does your party have any plans to address the health risks stemming from gun violence, which is considered a serious public health problem just as are opiates and measles? So this is a question coming from one of our viewers. Who would like to tackle that question?
I would
first?
love to answer that one.
Yes, please do.
It's important to know that in Canada, 95% of the gun crime that we're seeing are illegal guns and guns used illegally. And so the Conservatives have got a plan that goes from preventing guns from coming into the country, the illegal ones in the first place, to making sure that when gun crimes are committed, the guns are confiscated and not returned. The multiple offenders, there's a lot of gang crime in Canada. We have policies that will make sure that people that have offended under a gang offense cannot, as a condition of their probation, reassociate with gangs, and will result in stiffer punishment if they do. So we do have that plan, because the problem is new laws only are obeyed by lawful gun owners, right? If you put a handgun ban in, the criminals don't obey it. They still steal guns and use guns. So we need to address the root causes.
Thank you, Ms. Gladu. Someone else wish to tackle that question?
I'm happy to.
Thank you, Dr. Berman.
So, Jagmeet Singh spoke about this just a few days ago. There is more than, gun crime and gang violence are not simple solutions to fix. There's not one simple soundbite solution that's going to fix the whole problem. Obviously, we need to allow cities to have handgun bans. Can't think of any reason why an ordinary citizen who is not a police officer or security guard, etc., should need to have a handgun. And assault weapons, there's absolutely no need for anybody who's not in the military to have an assault weapon. So those things should be banned. But banning guns is not the only answer. As Ms. Gladu said, a lot of these guns are brought into Canada illegally. They are stolen. They are illegally obtained guns. So the question is, how can we prevent people from obtaining guns in the first place? Let's look at the preventative approach. Let's look at community programs to address the poverty, address the housing inadequacy, address underemployment. If we look at all of those things and we address those things, people will have an alternative to turning towards gangs. They can turn towards hope, and they can turn towards something positive rather than having no option but to enter into this fellowship, which is a gang, which provides protection for their own, because they have nothing to protect them outside of that. So what we need is a preventative approach. Look at the root causes of why people go into it. Not just say you can't hang out with a gang again if we catch you. Let's make it so that people don't need to look to gangs in the first place.
Thank you, Dr. Berman. Dr. Purdy, yes.
Yeah, so I agree completely with Dr. Berman, and but also with Ms. Gladu. In terms of the big issue are the illegal weapons on the streets, right? So the green approach is not to ban we do not want to ban semi-automatic weapons. And for anybody, I'm actually ex-military. The people, so it's just important to know that semi-automatic, all that means is that the bullet loads automatically into the chamber once another bullet has been fired, like once a weapon has been fired, but then you still need to pull the trigger every time. And this can be important if a person is hunting, because if you fire at a bear and you don't drop or kill the bear on the first shot, then it could be an unsafe situation, right? And if it's a deer, then the deer will just suffer more and that sort of thing. So the Green Party does not have a plan to ban semi-automatic. Fully automatic weapons should be banned. Our plan is basically to get the illegal weapons off the streets, and one of the big piece, of course, is illegal weapons and handguns coming in from the States. So that is a big point of interest. That's it.
Thank you very much,
Dr. Purdy. Project just a little bit. I think our government has been clear with respect to our plan moving forward with respect to banning assault rifles. Once again, as indicated, I worked as a social worker. I worked in the field of domestic violence for a huge part of my career, and I know that we're talking a lot about gang violence, but I think we also can't forget the issue of domestic violence. Most of the domestic homicides that I've responded to in my career was as a result of firearms as well. So I think that a lot of work needs to be done with respect to protecting Canadians, and I'm proud of the work that our government has done. I was a bit disappointed the last Parliament that some parties voted against the legislation that we brought forward. I think that no one would disagree that providing background checks, in-depth background checks, was a bad thing to do. I think that those are the types of responsible things that we need to do, and we need to do all that we can to protect Canadians from, these very, very deadly weapons.
Thank you very much, Madame Petitpas Taylor. So, this being the College of Family Physicians of Canada, we do have a question submitted about your intent to improve access to family physicians. So the question posed is asking, what is your strategy to achieve this, given that healthcare delivery systems are run provincially?
Well, clearly you have to work with the provinces and the territories on these things. But, there's multiple levels of problems in terms of getting more family physicians. Some of it has to do with the number of graduates and increasing them. And there are some great examples in Canada where places that don't have a teaching hospital actually are partnering with other communities to get the residents' experience there. And then those people can be transplanted into those communities. So part of it is supply. Part of it is the way that family physicians are remunerated under the provinces. In BC, for example, because of it's punitive to have a family practice versus being an ER physician where you don't have any overheads and in terms of the way that they're paid. So there's part there. And then there is a problem in the matching system. There are examples that I've seen in Cape Breton, for example. There are people that live in Cape Breton that got trained at recognized medical schools that want to be physicians in Cape Breton, and they have applied to the province and they're not able to get those jobs. And there's a 50% doctor shortage in Cape Breton. So, clearly you have to work with the provinces and territories to get to the root of why we're lacking.
Thank you, Ms. Gladu. Dr. Purdy, yes.
Yeah, I think Ms. Gladu raises some excellent points, and I'm glad that this question was asked because it's pretty, I'm going to argue, it's pretty dishonest to say we're going to get every Canadian a family doctor, as one major party, the Liberals, recently made that promise, because it's not going to happen. I can tell you that right now, because the problems, the issue, as any family doctor who's listening in, we all know this. The problems and the issues are multifactorial. Never mind the jurisdiction of provincial versus federal, but also family doctors, as Ms. Gladu points out, their remuneration. There's significant problems in some provinces, in many provinces, with remuneration. And so family doctors are making different decisions now in terms of how much they're willing to work for $16 a patient, for example. So I'm very glad the question was asked, because it's not an easy solution, and I think the issue, to be honest, is only going to get worse, because dementia is affecting individuals and families right now. It is not the epidemic it's going to be in a decade or so, and so it's going to get worse unless we really have a big system change in terms of, and it's going to involve federal, provincial, and I'd argue municipal efforts as well.
Great. Madame Petitpas Taylor, since part of that response was directed at the government, would you care to respond to this?
Absolutely. We are absolutely committed to making sure that we strengthen our healthcare system, to make sure that Canadians get high quality care and the care that they deserve. And that's why that it's extremely important to make sure that we continue to work with provinces and territories and to move forward to making sure that we shorten the wait times and that people have better health outcomes. We will continue to work with provinces and territories, but at the end of the day, we have to make sure that Canadians have access to a primary care provider or a primary health team. And that is why that we will continue to work with provinces and territories. And again, putting money on the table is a part of it. There's no silver bullet solution, and that is why that we'll have to work collaboratively in order to do the work that needs to get done to meet the needs of all Canadians.
Thank you very much. So, Dr. Berman.
So I think there are some things, definite things, that a federal government can do. I've talked about them a little bit in my opening, about direct funding, directly involved with First Nations, the military, anybody under federal jurisdiction. We can implement the patient medical home right there. I think it's important to look, if you're looking at all of Canada and at the different challenges we face, there are going to be slightly different solutions for different problems. But an integrated, multidisciplinary approach is really important. And I know that physicians especially are very wary when it comes to talking about physician assistants, nurse practitioners. But for those of us who have actually worked in collaboration with other healthcare professionals very closely in a team, we know that this works really well. And so promoting that type of approach and setting that as a standard of care in Canada is really important. We can strengthen the Canada Health Act. We can make healthcare a right and make it the responsibility of the provinces to implement even if they're going to choose their own way, they have to implement something to a certain standard. And we can use our federal spending ability to provide financial incentives to provinces, and we can also fund long-term incentives to individual physicians who make the choice to work in areas that are underserviced, and also support them so that they don't feel like they're being abandoned that way as well.
Great, thank you very much, Dr. Berman. So there is one final question from our viewers, and this relates to an issue that in the most recent poll I saw is number one for Canadians. And so the question is, please speak to climate change which impacts health. I've seen more respiratory illness, Lyme, decisions to not have children, and mental illness post-extreme weather events linked to climate change. The floor is open to answer this last of our questions of the debate.
Right. Well, the Conservative Party has a real plan for the environment. that doesn't just address the global climate change issue by increasing the amount of Canada's participation, not only here at home, but in leveraging our technology to help reduce the carbon footprint in places that are substantial contributors to the issue. But we will renew the focus on clean air and clean water and pollution reduction here at home. This is something that was neglected under the Liberal government, and the Conservatives will bring in a plan that will address those things. Because as you said, Lyme disease is hugely on the increase, for example. And under the Liberal government, they put a Lyme framework in that doesn't even have the basic testing protocol or the basic treatment protocol. So we definitely have more work to do there.
Thank you very much, Ms. Gladu.
I'm happy to speak next.
Thank you, Dr. Berman. Yes.
So again, how are we going to address climate change as it impacts to healthcare? Well, climate change is a very large issue. And as the question suggests, it has impacts on a lot of things, including our health, including mental health, including physical health. When there are huge extreme weather events, we have to clean up after that. We have to help the people who are traumatized by that, so there's going to be issues around mental health there as well. We have to do both. We have to address the effects of climate change, because even if we were to stop producing carbon right now, we've already damaged the environment to the extent that we are going to have to deal with the consequences. So we have to put into place a proper mental health strategy, proper national health care framework. Pharmacare is included in this too for people who have asthma, other issues that are exacerbated by pollution. We have to have that in place for everybody who is now affected by climate change. We also have to do our best to address climate change and keep it from getting worse. And that's why a carbon tax is very important. We support that. We would move forward with that. We can't put our head in the oil sands and forget that climate change is real.
Thank you, Dr. Berman. Dr. Purdy.
Yeah, so many people, actually, the family docs listening in may already know this, but over 7,000 Canadians died last year because of respiratory issues related directly to greenhouse gas activities. And also, of course, people in Quebec will probably remember over almost 100 people died in Quebec because of a heat wave last year. So it's already having significant impacts. And of course, in Ottawa, they had tornadoes. They never had tornadoes before. There's some serious health issues and ramifications from a climate crisis. So if we want to address mental health in terms of anxiety, depression, perhaps the first thing would be to do something about it, right? So the carbon tax is a nice start. Unfortunately, with climate crisis, it doesn't matter. You don't get points for partial effort. It's a failure. So whether it's the Liberal plan, the Conservative plan, and unfortunately the NDP almost get there, but there's a bit of an issue with fracking or liquefied natural gas. But you need to have a decisive plan, number one. But then also putting more money into healthcare in terms of mental health, that will be important, and also even for food security, because the cost of produce went up from 17% last year to this year alone, and that increase is due to decreases in crop yields. Thank you.
Thank you, Dr. Purdy. Madame Petitpas Taylor.
Thank you. I think we all recognize, and I think we would all agree, that climate change is certainly a huge public health threat in the 21st century, and we have to move forward with a real climate plan to address this very, very critical issue. Again, we see many individuals that are suffering from mental health issues as a result of what they're seeing and what they're going through, and many also health issues. So moving forward, making sure that the party that is going to be governing is going to have a real solid solution in order to address climate change. And I will in no way apologize to Ms. Gladu or anyone for putting a price on pollution. Scientists and the experts in the field have indicated that it's certainly the step in the right direction. If pollution is free, it will continue, and we have to put a price on it to make sure that people change their behaviors in order to improve our community, our planet for years and years and years to come.
Well, thank
Except
you
for large
very
industrial emitters, right? They get a 90% exemption under
Not
the
under
Liberal.
the NDP plan, they don't.
Yeah, and definitely not
Under the Liberal plan, they do.
No, they don't.
think-
Well, I am going to bring this debate to a close because we are right at 11 o'clock Eastern Time. And I would like to offer my sincerest gratitude to the four of you for making time to participate in the CFPC's healthcare debate. For viewers, we will post a recording of this debate, and we welcome your sharing it. I'd like to thank you once again, and to all watching, have a wonderful day.